High and rising healthcare costs are making healthcare less affordable and accessible for American families, leaving many with the decision to either delay medical care or pay for other life essentials. Today, we'll speak with a philanthropy working to change that. Let's welcome Dr. Mark Miller, Executive Vice President of Healthcare at Arnold Ventures. Dr. Miller, this is a very timely topic, so I wanted to ask you, what is driving higher healthcare costs and how does this impact patients right now?
So thank you for having me, and thank you for giving this issue some attention. So as I'm sure you know, there are many factors driving healthcare costs up, but the issue that I'm focused on today are the billing practices of certain high or large hospital systems. And the hospital systems are engaged in two practices. One, they will buy smaller hospital systems that will give them a very consolidated market position, and that allows them to raise prices. And there's a tremendous amount of evidence that that's what happens. The second thing that the hospitals are now doing is purchasing local physician practices. So your local physician, same service, routine medical services, drug injection, diagnostic test, and then they are able to raise the prices there, or alternatively, give you a second bill. You would get your normal bill from the physician practice, but then you would get a facility fee bill on top of that because the hospital owns the physician practice. And obviously, this escalates the cost of healthcare. And so the impact on the patient is that their co-payments go up. And you said this well in the introduction. Sometimes those co-payments discourage people from seeking care. So higher co-payments, higher costs, people are more likely to avoid care. And then also this has the effect of increasing the premiums people pay, the premiums that are paid on your behalf by your employer. And then if we go over onto the Medicare side of the ledger, it increases premiums, co-payments paid by the beneficiary and the taxpayer.
And Dr. Miller, we are hearing the term site neutral in healthcare. Can you explain what that term means and how it can help patients?
Yes, I hope so. So what that term means is this is a way to address this problem. And so once again, you're back to the physician's office, same physician, same service, routine medical services. And our point is those services, the price should remain the same whether your physician office is, whether your physician office is independent or whether it's owned by the hospital. And so what site neutral says is you cannot add that second bill. You cannot escalate physician prices up to hospital prices. The benefit to the patient, their co-payments don't go up. They're more likely to seek care. The benefit to local business, their premiums don't go up, and they're better able to afford health insurance or devote those revenues to producing more economic output. And then, of course, on the taxpayer side, it means the taxpayer pays less, and the elderly or disabled Medicare beneficiary has lower co-payments and lower premiums.
And can you give us some examples where patients were overcharged for services?
Yes, I will. And one thing I'll say is there has been a fair amount of press coverage on this. There's a couple of news outlets that have bill of the week features where people would bring their bills and say what's going on here. And this is certainly where I became aware of this issue. An example from Ohio, a woman who goes and gets arthritis pain. She gets injections once a month, $30 copayment. Practice is sold, facility fee is added, co-payment is $355, $30 to $355.
All right, Dr. Miller, you're giving us a lot of helpful information. Thank you for telling us about this, and you can find out more by going to arnoldventures.org.